Hi, my name is Emerson Perin, and I'm the Director of Research in Cardiovascular Medicine at the Texas Heart Institute in Houston, and also the Medical Director of the Stem Cell Center there, where we've conducted several trials, especially focusing on translational, but most importantly, clinical studies involving patients with heart failure. Cardiovascular disease continues to be the major cause of cardiovascular mortality in the United States as well as in Europe. And interestingly, as time goes on and our treatments for cardiovascular disease evolve, we have a significant larger fraction of these patients that have more significant disease or more involvement of their coronary arteries. In these patients that have more severe involvement and extensive coronary disease that really aren't amenable to revascularization procedures, cell therapy has been one of the methods that's been explored to attempt to treat these patients, improve their quality of life and symptoms. This is the first trial ever of adipose-derived regenerative cells placed in the human heart. So it's truly a pioneering experience in a group of patients that really can't benefit from anything else in conventional terms except for medication. This is very important then to be able to test this type of stem cell in this patient population, since most of the trials have really focused on bone marrow derived cells, either be it bone marrow mononuclear cells or specific cells derived from the bone marrow. The adipose tissue is very convenient, it's very accessible. The procedure is not difficult to get a small amount of fat from this patients, usually from the lower abdomen. This can be done in a matter of minutes. The cell processing takes approximately 2 hours, and thus one can envision that this could be a practical way in which we could treat these kinds of patients in the catheterization laboratory. In looking at the PRECISE trial, to really see a hard endpoint, such as oxygen consumption in patients, which really is the endpoint. It's the endpoint that we use to choose patients that are going to qualify for cardiac transplantation and really defines functional impairment. So to take those patients and have them perform well over time and over a significant period of time, I'm very satisfied that we see the results, these results in this trial, and it really points us in the direction of really wanting to explore this kind of therapy further. So when we look at the functional outcomes in these patients, it's very important to see that when we place these patients on the treadmill and observed their ability to exercise as well as their oxygen consumption, which is a very detailed evaluation of what these patients are able to do, we are able to really separate out the groups. And more importantly, the differences that we saw were significant and sustained over a long period of time with a mean follow-up of 28 months. So at the 18-month time point following the treatment, the patients that had received the cells that were all evaluated were found to have sustained improvement, whereas the patients that were control patients had received placebo injections in a similar procedure as those receiving the cell treatment had a progressive deterioration in their functional capacity that went gradually down up to the point of 18 months. Also, as measured on the treadmill test, their METs, or metabolic equivalents, were very significantly different between the two groups, indicating that the patients that received cells were functionally more able to perform on a treadmill, which really translates into their ability to perform work at home or exercise or interact with their families to a very significant degree as compared to those patients that had continued worsening over time that did not receive the cell treatment. In summary, we're extremely excited to be here at the American Heart Association meetings and being able to present this data for the first time that adipose-derived regenerative cells are presented in the setting of a patient population of chronic coronary disease with no option, and that we see a complete follow-up that extends actually out to an 18-month period, and that we see that, first of all, the administration of these cells were safe, and there were no evidence of any adverse issues regarding their administrations or the procedure of their administrations, and that the patient really tolerated these cells very well. One of the more important findings in this trial, I believe, is really the following of these patients over time, where we saw an initial improvement in the patients that received the cells as compared to a deterioration at 6 months in the control patients. It's extremely interesting, and I think of significance, to see that these patients over time, over another year after the 6-month follow-up, continue the natural history of progression and worsening of the coronary disease with a worsening of their functional capacity when placed on a treadmill and having to perform oxygen consumption studies. Whereas the patients that received the cell therapy sustained that improvement for another year after the initial 6-month endpoint.